High school football is back along with other sports, but this year with COVID, there's a new playbook.
Yeah, it is a tough situation.
Dr. Manish Bajracharya, who goes by Dr. Manish, is a pediatrician at Orange Park Medical Center. When you're considering if your child should play on school teams, he says first look at COVID numbers in your community. In Northeast Florida,
It is certainly less than last month, and every day it is getting better.
and that tells him
I think we can be very vigilant and careful about how we open up our kids to the sports.
it may seem unrealistic to wear masks while playing or practicing, but he strongly suggests it because players will be breathing hard and droplets will be traveling farther. And masks are not just for the athletes.
Even for the spectators, coach, and sideline players.
The doctor says contact sports might be the riskier play when it comes to spreading COVID. He says sports where you have fewer people and you're more spread out are safer.
Outdoor sports is better than indoor sports.
Dr. Manish also suggests using your own equipment if you have it instead of what the school provides. He predicts the more people get together for practice, play, and to watch sporting events, the more likely the COVID numbers will jump. But it's also a balancing act for students.
The sports has tremendous benefit, not just for the physical, also for the mental health.
He suggests getting creative with practice and competition and being willing to bench athletics if COVID rebounds. Jessica Clark, First Coast News on your side.